Hi, my name's Catherine Harrow, and I'm an analyst in the Oranga Tamariki Evidence Centre. So the Evidence Centre completes research, evaluation and analytics work to support the business. So today I will be speaking to you about some recent literature that describes recent experimental and quasi-experimental studies, and I'll explain what these are shortly. So these studies have explored the impact of welfare and tax policies on child maltreatment outcomes. So briefly, some context for the work. So the Welfare Expert Advisory Group was established in May of last year by Carmel Sepuloni, the Minister for Social Development. And the purpose of this group was to review New Zealand's social welfare system. So their report is expected to be released sometime in early April. As part of supporting the work of the group, the Ministry of Social Development and Oranga Tamariki completed a joint piece of work. And this project explored the impact of Section 70A benefit deductions on children and young people and what the impact of removing these deductions might be. There was also some interest in Section 70A prior to the establishment of the group. So in mid-2017, the then Minister for Social Development instructed MSD to complete research on the effectiveness and impact of Section 70A. And in October 2017, the incoming government said that it intended to remove the Section 70A benefit deductions. So you're probably wondering, what is Section 70A? These benefit deductions refer to a policy designed to encourage claims for child support. So this policy requires that parents who receive a sole parent benefit apply for child support from the other parent. And this money is withheld while they're receiving a benefit to offset the cost. For each dependent child they do not seek child support for, their benefit is reduced by between $22 and $28 per week. So on average, this works out to a family having a $34 reduction per week, or about a 10% reduction in the sole parent support benefit. Now there are some exemptions to this policy. So if there's a lack of evidence to establish who the other parent is, or the parent is taking steps to identify the other parent, or there is fear of violence. So the joint project that we did with MSD included a descriptive profile of children affected by Section 70A, and this was done using work and income and Oranga Tamariki administrative data. And this work was led by Maura Wilson, who's our principal over at MSD. It also included a review of some recent literature on empirical studies that explored the impact of benefit sanctions and tax policies on child maltreatment outcomes. And this was the part I was mostly involved with. The final report also summarised some recent qualitative work, which explored Māori and Pacific mothers' experiences of benefits and child support. So this work was sent in draft to the advisory group in August of last year and shared with joint ministers in October. And sorry, it might be a bit less exciting out of those options, but yeah, what I'll be talking about is some of the key findings from those experimental and quasi-experimental studies. First, some context. So what do we know about the relationship between low income and outcomes for children? So firstly, this is a contentious area, and internationally there is a lot of debate around it. In saying that, there is a large body of work that has linked child poverty to a range of negative outcomes relating to health, psychosocial development, education, and involvement with child protective services. The relationship between low income and child neglect is also well established. However, it is important to note that the majority of families, whether living with low income or not, do not harm their children. So, why does low income sometimes lead to negative outcomes for children? The two main theories that are used to explain this relationship are the what money can buy and the parental stress models. So the basic argument of the first model is that higher income enables parents to purchase better quality housing, food, early childhood education and schooling, as well as extracurricular activities. And all of these contribute to improved outcomes for children. On the other hand, if parents have insufficient incomes to meet children's basic needs, then this may increase the likelihood of some indicators of neglect, such as inadequate clothing and medical care. In contrast, the parental stress model argues that low income impacts the likelihood of poor child outcomes through increased parental stress. So maladaptive coping mechanisms, parental conflict, mental health issues or substance use may all be triggered or exacerbated by stress. Now these theories are not mutually exclusive, so both could be affecting families and children's experiences. So before exploring the relationship between low income and child maltreatment further, it's important to mention that although a large body of research shows a link between income and children's outcomes, the majority of this work cannot be used to understand whether low income causes poor outcomes for children. And partly this is because establishing causal effects is notoriously difficult. So in order to understand whether the link is causal, studies need to use empirical designs to control for bias and confounding factors. So what makes an experimental or quasi-experimental design? I won't go into this in too much depth, but briefly, experimental designs, such as randomized control trials, control for confounding factors through randomly allocating participants from the same sample to either experimental or control conditions. So an example in this area would be randomly allocating participants to a new benefit policy with additional or stricter financial sanctions compared to business as usual. So these designs minimize confounding factors so that any differences in outcomes between the two groups are more likely to be due to the variable of interest, so the new welfare policy. So in contrast, quasi-experimental designs include natural experiments, where assignment to the experimental or control condition is driven by environmental factors, such as state government decisions to set benefit levels at different rates. Statistical techniques can also be used to approximate an experimental design and identify comparable control individuals. So these studies are not as robust as a true experimental design, but the argument is that they still allow you to make conclusions about whether a factor like low income causes poor outcomes, which is not possible with correlational designs. So it's important to mention that although these types of designs have the advantage of supporting you to infer causality, they still do have some limitations. The reality is that completely measuring and eliminating the impact of confounds is not often practicable. So this is particularly the case with the relationship between income and child outcomes, which is complex. Income changes can have differing impacts depending on child, family, and community level characteristics, which can act as risk or protective factors. Quasi-experimental studies in particular face challenges with obtaining unbiased samples and fair proxies. So participants are often identified through their contact with government agencies, so there are some issues with selection bias. Studies are also limited by what data is available, which is often administrative. So a couple more limitations. So one of the key issues with the applicability of these studies that I'll be talking about today is that most were conducted in the United States. So this means you need to be cautious around applying these to the New Zealand context. Another challenge is that across the different studies, there are different measures of maltreatment, different welfare systems, and child protective service practices, which limit your ability to make direct comparisons across studies. And so because of these issues, I'll be talking about the findings of these studies a bit more generally. So, what happens when welfare payments are reduced? So there is some evidence that lowering welfare payments can increase rates of entry into care. So a Danish quasi-experimental study found that reducing welfare payments can lead to substantial increases in rates of out-of-home care. So in 2004, the Danish government introduced time-dependent welfare payment ceilings. So basically, caps were introduced, which limited the amount of benefit that was available the longer it was drawn down. This policy meant that some mothers experienced a sharp decrease in welfare payments, which worked out to be about 30% of their disposable incomes, which is obviously quite a lot. And that income change increased children's risk of out-of-home care by 25%. So in addition to increasing rates of entry into care, there's some evidence that lowering welfare payments can increase the likelihood of neglect. So Fine and Lee examined the impact of a welfare reform package in Delaware, and they used stricter penalties to encourage beneficiaries to obtain employment. They used an experimental design where participants were assigned to either business as usual, which was the control group, or a new policy which included strict penalties for failing to meet job searching and job readiness requirements. So what the researchers found was that the group assigned to the stricter approach experienced more benefit deductions, which you'd expect, more employment, which suggested that the approach was somewhat successful in increasing employment, but also more cases of substantiated neglect. So I'm going to spend a little bit of time talking about this study because I think it illustrates a few points that I think are interesting. So first of all, this study is a good example of where multiple elements change at once. So employment was changing alongside income. So this is particularly problematic as increased levels of employment could have positive or negative impacts on parents. So if mothers gain improved self-esteem and mental health from working, then this may reduce rates of abuse. But if parents are unable to access or afford childcare, then returning to work may lead to an increased likelihood of neglect through inadequate supervision. So what happens when benefit amounts and earnings increase? So a key finding is that small increases in income can substantially reduce the likelihood of involvement with child protective services. So as part of a randomised control trial in Wisconsin, mothers who made use of temporary financial assistance to meet basic needs, so to meet food, housing and utilities, received either a full or partial pass-through of child support payments. So what this means is that if the mother has lodged an application for child support from the other parent, then they will receive some or all of that support in addition to the temporary financial assistance. So this was a change from standard practice, which was to retain child support payments to offset the cost. They found that an average increase in income from child support payments of $100 per year led to a 10% reduction in the odds of having a maltreatment report screened in for further assessment. So the finding that small increases in income can reduce the likelihood of involvement with child protective services is supported by another study. So this study was conducted in the United States and examined state-level variation in benefit levels. They found that small increases in income can substantially reduce the likelihood of child neglect and entry into care. So a 10% increase in the maximum benefit was predicted to reduce rates of neglect by 39% and the foster care population by nearly 20%. So policies that increase earnings through tax credits have also been shown to reduce the likelihood of neglect or involvement with child protective services. So one study examined the relationship between income and child maltreatment outcomes, which are child protective service involvement and abuse and neglect type parenting behaviours. They used survey data in a quasi-experimental design, which made use of differences between states and over time and the amount of refundable tax credit available to low-income earners. So a key finding was that a yearly income increase of $1,000 significantly decreased the probability of child protective service involvement by 7 to 10%. This income increase also led to a modest reduction in rates of self-report neglect type parenting behaviours. So in addition to reducing the likelihood of child maltreatment outcomes, policies that increase earnings can also improve child developmental outcomes. So reviews of experimental and quasi-experimental research in the States show that earning supplements have small but consistently positive effects on child development and education. So earning supplements are designed to support people to move from benefit to work. They include increasing the amount that can be earned through work without affecting benefit amounts, and providing supplements to income through earnings separate from the benefit system. So improved developmental outcomes have been linked to parents using their increased income to purchase child centre-based care, which is consistent with the what money can buy model I mentioned earlier. In contrast, policies that encourage employment without increasing income, such as mandatory work activities or time limits for benefit receipt, do not have clear benefits for children's development. So the previous studies I've mentioned suggest that increasing income can reduce the likelihood of involvement with child protective services and child maltreatment, as well as improve children's developmental outcomes. Investment in short-term financial supports to meet material needs has also been linked to reductions in child maltreatment outcomes. So one study made use of a natural experiment in the States where families with both open child welfare cases, mostly relating to neglect, and receiving home-based support services varied in whether they accessed discretionary funds. So the purpose of these funds was to cover basic needs, including food and utilities. They found that the group that accessed the funds was 17% less likely to have a re-notification in the next year. So far I've talked about a couple of studies that have found a significant impact of income changes on outcomes for children, but that isn't always the case. So some studies find mixed results or no evidence of a relationship, and I've listed a couple there. Now I won't go into each of these studies in much depth, but I will talk about some of the general issues. So null or mixed findings might reflect a weak relationship between the income and outcome measures. So for example, there's more mixed evidence on the relationship between unemployment and child maltreatment compared to direct measures of income. Null findings may also be driven by methodological issues, such as problematic proxies. So some studies have used uptake of food stamps, which is food purchasing assistance, as a proxy for poverty, as recipients must be living on a low income in order to be eligible. And the issue with this proxy is that it will not identify those who do not participate in the program due to a lack of knowledge, inability to sign up, or by choice. There are also some challenges identifying appropriate control participants in quasi-experimental designs. So for example, Lee et al., which I mentioned on that previous slide, conducted some statistical tests, and that suggested they didn't manage to identify comparable control individuals as part of their design. There are also limitations to available administrative data. So information is not always available on how money is spent, which makes it hard to explore findings. And this issue highlights the value of mixed method studies, where administrative data is supplemented by richer qualitative data or case studies that explore individuals' or families' experiences or responses to programs. And knowing me, I've probably raced through all of that. So just some final comments. Oops. So there is some evidence that lowering welfare payments can increase rates of child neglect and entry into care. In contrast, small increases in income can substantially reduce the likelihood of involvement with child protective services, child neglect, and entry into care. And policies that increase earnings can also reduce the likelihood of involvement with child protective services or neglect. There's also some evidence that short-term financial supports to meet material needs can lead to reductions in child maltreatment outcomes. However, it's important to remember that though these findings seem, clear-ish, these designs do have limitations. There's different welfare systems, measures of maltreatment, and service practices across jurisdictions, which make direct comparisons across studies difficult, and there is a lack of evidence in the New Zealand context. That's me. There's my contact details if you do want to get in touch and ask any further questions after the session. We will be joint publishing the brief that I wrote as well as the wider project report on MSDs and our website, so keep an eye out for that if you like. We will be timing it with the release of the advisory group report, so not 100% sure when that'll be, so keep an eye out on their website as well. Thank you.